Hello all, my name is Dr. Christopher Atalla. I'm a urologist at Good Samaritan Hospital, and I'm here to talk to you all about kidney stones today. So on today's agenda, we have a few topics to talk about. We'll go into a quick introduction about kidney stones, the incidence of kidney stones, how stones are formed, the different types of kidney stones, how someone may present when they have a kidney stone, the treatment of kidney stones, and how to prevent kidney stones. So, kidney stones are also known as nephroliths or renal calculi. They're typically made from deposits of minerals and acid salts within the urine. Kidney stones have several different types of compositions, and it's important to know that there are other types of stones within our body. Oftentimes you'll hear of gallstones, and they're actually completely separate from kidney stones and form in a completely different way. So what's the incidence of kidney stones, or how prevalent are they? They're more common in men versus women, about 10% versus 7%. Throughout time, we've noticed that the trend or the incidence of kidney stones has actually been going up over the years. So in the 70s, there was significantly less kidney stone incidence versus now, which may be related to dietary changes. As we get older, it is more likely that we'll end up developing a kidney stone as well. People with a family history of kidney stones are definitely at an increased risk, so if mother or father had kidney stones, that certainly puts you at a little bit higher risk. There are certain seasonal variations which can play a role in stone formation. The peak incidence is certainly in the summertime. As it gets hotter outside, we become more dehydrated, and that can lead to an increased likelihood of getting kidney stones. So how do stones form? Typically the urine, when it's super concentrated, has certain constituents that crystallize and can harden into kidney stones. The stones typically form when there are increasing levels of certain stone-forming substances, such as oxalate, uric acid, and calcium. Stones may also form when we don't have enough of the substances that actually inhibit kidney stones, such as citrate or citric acid. So this is a fancy diagram that kind of shows the nitty-gritty of the kidneys and the filtration of the kidneys, and what it's essentially trying to show is the urine getting filtered through the filter system of the kidney, and when the urine is super concentrated, some of these deposits can form in the within the drainage system of the kidneys, known as the collecting system, and may form a kidney stone. So there's a lot of different kinds of kidney stones. These are some of them, not all of them, but the most common ones. Calcium oxalate certainly being the most common, followed by calcium phosphate, uric acid, struvite stones, and cystine stones, and we'll go into a little bit about each one of them. So calcium stones, again, is the most common type of stone, the majority of which are calcium oxalate. Oxalate is usually found in certain foods we eat, which we'll go over later, and is also formed by the liver. Calcium phosphate stones usually form when the pH of the urine is too alkaline, which means the pH is too high. There are other stone types, including uric acid, which typically forms when the urine pH is too acidic or when the pH is low. Can also form with certain disorders such as gout, which is a disease of the joints. Certain patients who are on specific types of chemotherapy may be at an increased risk of forming uric acid kidney stones, and certain diets that are high in purines, especially red meat, may make you more likely to form uric acid stones. A struvite stone is a certain type of stone that is related to certain bacteria that may live in the urinary tract and cause not only urinary tract infections, but may actually promote stone formation. And they actually can cause very big stones known as a staghorn stone, which we'll look at in a minute. Cystine stones are caused by a rare genetic disorder known as cystinuria. This is certainly less common than the other ones we've discussed. So this is a picture of a staghorn stone, and this is formed by the certain bacteria from the struvite, and so you can see that this is a stone that was removed from the kidney and basically encompasses the entire inside of the kidney. And so these can be very difficult to treat, and surgery can be quite extensive to take care of them. So how do you know if you have a kidney stone? How is someone going to present when they are passing a stone? So typically when a stone is non-obstructing, meaning not causing a blockage, you may not even feel them. And these stones are usually asymptomatic. However, if you're passing a stone, usually patients will experience severe flank pain, abdominal pain, nausea and vomiting. The pain can radiate from the flank into the groin, in men into the testicles. If the kidney stone is significantly bad, it can cause infections with fevers and chills, and sometimes you can have blood in the urine. So this diagram just shows kind of different locations for the kidney stones. The stone that's within the calyx in the diagram is what I was referring to as a non-obstructing stone. So these stones tend to just live in the kidney and usually do not cause pain. Stones within the ureter in the lower part of the picture are the stones that cause obstruction and typically cause the symptoms I described before. And in the upper part of the picture as well, you can see the staghorn stone kind of in the diagram as compared to the real life picture. So what do you do if you think you're passing a kidney stone? Definitely get seen by a doctor. Don't wait. You know, whether that's your primary care doctor or going to the emergency room or your urologist. If the physician suspects that you're passing a stone, you can expect to get a CAT scan done. In some scenarios where a CAT scan may not be ideal, such as in someone who's pregnant or someone who's had repeated CAT scans, sometimes an ultrasound or a KUB, which is a type of X-ray, may be performed instead. And this is just two pictures of what a CAT scan looks like with a kidney stone. On the left-hand side, the white dot on the right side of the picture is a kidney stone, and above it you can see a lot of swelling in the kidney and the drainage system that is consistent with a stone causing a blockage. That's known as hydronephrosis on the kidney. The right side picture shows the same thing. So what do we do? How do we treat kidney stones when somebody comes to us, whether it's in the ER or in the office? So for a lot of the management is based on the size of the stone. And somebody who presents with an obstructing stone that's less than 10 millimeters, the ideal situation is to try to manage it non-surgically. And per the American Urologic Association guidelines, patients may try to pass a stone as long as it's less than 10 millimeters. And how do we have patients pass a stone? The most important thing is to drink more water. The more water you drink, the more likely you are to push the stone out and get it to pass. We also give alpha blocker, which is a type of medication that helps relax the ureter and make it more likely that you pass the stone and increase the stone passage rate by about 10 to 20%. We'll certainly give you pain medication to ease the discomfort of passing the stone and give you a strainer that you'll actually urinate into to try and catch the stone when it does come out. There are certain scenarios where surgery or procedure does need to be done on a more urgent or emergent basis. Those include sepsis, which is a type of infection that's spread to the blood, obstruction in both kidneys at the same time, meaning you're passing a stone on both sides, or if you only have one kidney and you're passing a stone. Those are all indications to put in what's called a stent, which is a type of drain that relieves the blockage from the stone. And this is a diagram showing what the stent is. That blue line that goes up from the kidney all the way down to the bladder is the stent. And it bypasses the obstruction from the stone. It has tiny little perforations along the stent that allow urine to pass through it so that the kidney isn't blocked up from the stone. So there are more elective types of procedures and surgeries for kidney stones as well. Extracorporeal shockwave lithotripsy is one that a lot of patients have heard of. They come to the office and ask, well, what about blasting the stone? And that's what this is. It's the most minimally invasive type of surgery. It's most effective in kidney stones that are within the kidney or in the proximal or the upper portion of the ureter. Of the types of treatment, it certainly has the lowest morbidity and complication rate. However, the clearance rate, or the likelihood that all the stones come out, is a bit less than other types of surgical management. And the good thing is this is an outpatient surgery, meaning you get to go home the same day after the procedure. Another common type of procedure is called ureteroscopy, often with laser lithotripsy. This is a bit more invasive than shockwave lithotripsy, but it does tend to have a higher stone-free rate than the lithotripsy. This can be performed for stones anywhere along the urinary tract, from the kidney down to the bottom most part of the ureter. Again, this is also an outpatient procedure. A bit more invasive is the percutaneous nephrolithotomy. This is reserved for very big kidney stones like the staghorn stone that we saw earlier, or stones that are usually greater than 20 millimeters within the kidney. So this is a diagram of the ureteroscopy, and you can see the scope goes in from the urethra into the bladder, and we're actually able to get into the ureters through the bladder and use a small laser to break up the stone, and this diagram is showing the basket that pulls the little stone pieces out. This is more of a live picture, kind of showing what the operation looks like when you're doing a ureteroscopy. So in the first picture, you see the stone as it is whole. In the second picture, you can see that little clear piece is the laser with a green light on the end of it. And the next two pictures are showing the stone being broken up. And the second to last picture shows that basket kind of pulling the pieces out. And then at the end, you can see that the ureter is completely open and there's no stone, no more blockage there. Now, it's important to know that this isn't, when we do this procedure, it's very magnified, and this is actually a very small space. It's like putting a camera within a straw. So it looks big, but this is actually very small stuff. So this diagram is depicting the percutaneous nephrolithotomy. Essentially what happens is an incision is made in your back, and a tract is made that goes directly into the kidney. And the reason this is effective for larger kidney stones is because there's a large tract with a larger scope than what we use for the other types of procedures, and we're able to pull out bigger pieces of stone at a time. So now that we've talked about all this, kidney stone surgery, and if you've had a kidney stone, you want to know, well, how do I prevent it so I don't have to go through all this again? The most important thing that you should do is to increase your water intake. And this is really important for everybody, not just people who have stones, but in general, it's good for your overall health. And so the general guideline is to drink 2 liters of water a day, which is about 64 to 67 ounces of water. And that's a lot of water. Other things like adding lemon to your water, which contains citrate, which, as we discussed earlier, is an inhibitor of kidney stones, will help. Diets low in salt are helpful. A big misconception is that your stone is made from calcium. You should avoid calcium. That's actually a misnomer. It's important to maintain regular levels of calcium in your diet, so you shouldn't go out of your way to try to reduce your calcium intake, because calcium is important in binding with oxalate, which we mentioned earlier is a stone former, and that kind of actually prevents stones from forming. And so decreasing the oxalate intake for calcium oxalate stones involves a lot of dietary changes. Major things that contain oxalate include spinach, chocolate, tea, nuts, rhubarb, dark sodas like Coca-Cola, and excessive vitamin C intake all contain oxalate, and it's a good idea to try to reduce these things. I don't think it's realistic to try to avoid these things altogether, but just consciously reducing your intake of these different types of foods may help reduce your likelihood of forming a kidney stone. It's important to know that after your first kidney stone event, the likelihood of a repeat stone event is about 50%. So no matter how well you do at following all these guidelines, even if you do everything perfectly, it's still possible to form a stone. And that doesn't mean that you did something wrong. It's just something within the body. So this is, I'm sure a lot of people have seen these now, these water bottles that kind of have like motivational lines. They're typically 64 ounces, which is the 2 liters. And this is a good way to kind of make sure that you're getting your 2 liters of water in every day. You can buy these on any online store. In terms of medical management of kidney stones, this should always be under the supervision of a physician. There's a lot of things that you could buy online that talk about preventing kidney stones or affecting your pH, and you shouldn't really do this on your own without a doctor monitoring your urine pH levels. So potassium citrate is one of those things, again, a supplement that you can buy online, but you should really take it with a doctor's supervision, because what it does is alkalinize the urine, or actually raise the pH. That needs to be a fine balance, because if you raise the pH too far, you can form a different type of kidney stone, the calcium phosphate stone, which we discussed earlier. This is also useful for uric acid stones, where they are formed from a very low pH, and calcium oxalate stones as well. Allopurinol is a type of medication that reduces the amount of uric acid in the blood, and may actually help prevent formation of kidney stones. It's typically used in conditions like gout. And that's the entire lecture on kidney stones. Thank you all for listening. If you need a urologist or you think you're having kidney stones, you can certainly come see me in Bayshore. Our office phone number is 631-665-3737. And for additional information, you can also call 631-376-4444 or go to good-samaritan-hospital.org. Thank you.